Yeah, if you could go up a little bit. You happy for me to carry on?
Yeah, no, that's fine. Yeah.
I'm Tom Gale, I'm a consultant anaesthetist at Laerdal Hospital, and I'm the chair of the Simulation Training Steering Group for this trust.
Can we recheck the touch when I just make sure it's on?
Yeah, the chest.
We've been doing simulation at Laerdal Hospital for the last 5 years. We started doing that with SimMan Classic, and then over the last 2 years we got 3G.
People perform badly, don't they, under pressure. They make more mistakes. The communication tends to decrease, doesn't it, or stop altogether. And the team working fails.
The great value of having SimMan 3G is that you can set up in situ simulation programs much more easily. We were doing simulation sessions in clinical environments before, but it would take 3 individuals about 2 or 3 hours to set up the simulation environment. Now with SimMan 3G, we can do that in about half an hour. We can wheel SimMan 3G down on a trolley, bring them into theatre, and off you go. It's much quicker.
So can we just confirm the patient, please?
We do simulation programs for a wide variety of health professionals. We have got a program for anaesthetists, for our novice anaesthetists and a more experienced anaesthetist. We do a program for all of our foundation doctors in the hospital at F1 and F2 level. And we do team training for a wide variety of specialties, including a rolling program for all theatre teams, which get in situ simulation training now actually in their workplace. I think the benefits of in situ simulation are that you can actually bring the simulation scenarios actually into the workplace. And there's a whole host of benefits from that. One is that you contextualise the simulation so that all the scenarios are authentic, and that the lessons learned from the scenarios are much more easily transferred to the workplace.
Yeah, they did the drop, it's fine. Yeah.
The other benefits of in situ simulation are that you can actually identify latent threats in the environment in people's workplaces by doing these simulations, and then you can end up reporting problems in those environments to various structures in the hospital, such as quality and safety boards. We have used real-life critical incidents in our simulation scenarios, which have been very valuable. So before the theatre teams come to the simulation sessions, we ask them what sort of critical incidents they've had in the last 6 months, and we get them to fill in a form in to give us ideas of the critical incidents they've had and also near misses. So then we can tailor the learning objectives to those particular scenarios, to that particular group of people.
Let me see if I can manipulate the air.
The whole thing is enjoyable. You know, these theatre teams come together, they don't get theatre team training in this context. A lot of the training that they get are in their own professional groups, and it's a great chance to give them training within their own teams so they can have collaborative learning, and they have a lot of fun doing it, which is great. But also there's important messages, and I think they can see that there is a lot of value in this type of training.
I found in situ training, so performing this resuscitation scenario in theatre, really useful because we're in an environment where all the staff know what they're doing and are used to the areas in which they need to get equipment. It's far more realistic as these nurses and surgeons and anaesthetists are working in this environment every day, and provides a more realistic scenario to prime people for when a real disaster potentially might happen. The SimMan 3G responded in the ways in which I'd expected him to, with all the interventions that I've made for the airway, breathing and circulation aspects of the problem. Right, shall we attach that up?
The mobile nature of SimMan 3G has enabled us to create simulated environments across the whole hospital. They're not restricted just to our simulation suite. We can do simulation in theatre environments, we can do it in ICU, in HCU and in the emergency room. And this is very important to bring simulation across a wide variety of healthcare groups. And this has been stressed in the recent Chief Medical Officer's report and also Lord Darcy's next stage review. And we think that in situ simulation is a perfect vehicle for which to give this type of training.